develop a 501c3 organization so that they could get funds to actually train the residents to be in charge of their own issues. So that's kind of like, what do we do next with this? We don't want to come up with, here's a problem and then leave it. We wanted to come up with a solution. After we find out that problem, what can we do with that? So I just kind of like wanted to kind of frame it around demolition, what we did in Baltimore. And because of that, we've worked with Detroit, Cincinnati, and even Holland. They called us. They didn't know that we had done all of this, and they called us and said, well, somebody recommended that we talk to you guys. And I was like, duh. So we did. We talked to them. We met with them in the community, and they were so afraid. This is like you all here at that last meeting after their project was over. They were afraid to even go to their own meeting because there were so many people there to thank them for doing a good job of listening to what they asked for and making it happen. So I just wanted to tell you that story. And my colleague here, Barbara Bates-Hawkins,
Joining up from here, as I normally say.
she can give you some other stuff that we've done.
Yeah. Just like the gentleman at the end, I'm Barbara Bates-Hopkins, and I work with Pat Tracy as a Community Engagement Coordinator at Johns Hopkins School of Public Health in the Center in Urban Environmental Health. I also serve on the Environmental Justice Partnership Board, the Community Board. This is already talked to you all about. Initially, I worked in the community as a community advocate or a community organizer for Historic East Baltimore Community Action Coalition, which was an umbrella organization, or is an umbrella organization for East Baltimore, where there are a number of small organizations that are underneath of that umbrella. So I think an asset that I brought to the table and joining at the hip with Pat was knowing the community. We talk about knowing who is really in the community and who are the movers and the shakers, the block watchers, as we call. So I grew up in East Baltimore, and that was another asset. So I have the privilege of working with people that from generations, people know my mother and grandmother. So it's that connection that I live a little north of East, northeast East Baltimore, but I'm more home in East Baltimore because I like to know everybody there, more so than my immediate community. But getting back to what we do, some of the things that Pat already spoke to, lessons learned, what we did after we build these relationships, and I like to say these trusting relationships, we started developing materials that I tend to coin as innovative materials. We started dissemination materials where we created different games. We did what we call a Family Feud game, Pin the Tail on the Pollutant. We had an Asthma Idol game where we had, and we just didn't develop them ourselves. We had the input of the community, and they wrote these songs, and when we would go to health fairs and helping to disseminate the research findings, we would present it in this kind of a format, and it was just received quite well. So we also developed what we call our Day at the Market. There is a Northeast Market just down a couple blocks down from the School of Public Health. And we go to that market. It's a great venue where everybody comes there. Hopkins comes there, people hang out there, people that are visiting, people in the hospital are there. Students come down there as well that attend the school, so there's staff and professors that come down there. And then the merchants. So here we are in front of this food court, and we bring down what we call our white jackets. We bring the researchers down because the community says they have researched and run. So in this format that we've developed for them to get culturally sensitive forms of information back to the community through the conversations, through focus groups, they are there and they're engaging the people. And what's so great about it, we just don't bring that material. We listen to what the people want, what they're talking about. They may tell us about anything, and Lisa Cooper came down. She's in charge of the cardiovascular department at Hopkins. I do want to point out the gentleman on the end said he was from Hopkins. Wait, I don't know him. The misconception of the fact, and when we say Hopkins, everybody thinks everybody knows everybody. And so when you bombard the community and they'll say, oh, he was there, or this person was there, we are a huge place. And that's one of the things that we learned. Pat and I talk about developing this conference where we can bring everybody together that's doing outreach so that we can know what everybody's doing. And the community is not overwhelmed. But that hasn't happened yet. That's on our agenda to do that. Anna, one of the researchers that we're working with, many times researchers come to us and they say, how do we get into a community? They were looking to get into the Turner Station community. And so we had the opportunity to support them with that. But one of the ways in which we do that, as I spoke to knowing much of the history of East Baltimore, I knew little history in Turner Station. I had a girlfriend that went there, and so, I started doing my homework, and I met the right people, developed a relationship with them, and then talked to them about our research buddies. And then we met with the key people in Turner Station. They looked at what the researchers wanted to do, and they were able to get their input. They gave their input. They developed a flyer. The community did. This nucleus, about 12 of them. And then they invited us to their meetings. Those researchers are now like family to them. They go to every community meeting. They give back. They're at their health fairs. They give door prizes. They translate different researchers that have been in the community that have not given back. They translate their reports for them. So this is the kind of thing that, and then when they first went there, I want to say that they didn't get their grant. And so, but they continued to go. They just didn't tie it around, we want to do this grant. So that's that trust that they built with that community. And that's very important. That comes out of that listening to the community and identifying who are the leaders in the community and then building that trusting relationship. There is another organization, we sit on a number of boards that's called CRAC, Community Research Advisory Council. And they developed a component wherein we talk about this bi-directional training. And what they did, they went out into the community through the churches, did an assessment to find out what health concerns those particular churches in their communities wanted to know more about. And when they got the assessment back, and they then connected it to the research that was in Hopkins. Then they got researchers that had conducted the research to develop a training module so they could train the health coordinator in the church. So that person will be better able to reach that group of people. In that process of training them, they presented their PowerPoints and their presentation to this group of people, these health coordinators and these pastors, and allowed them to critique it. I mean, they tore it apart. There were some researchers that were too technical, they went too far. And it was so very helpful. So when I talk about this bi-directional training, it's like researchers learn too from the community. I don't want to hear all that. I mean, really. And they think, well, we need to tell them all of that, and it's like a little too much. So that was another learning process that we learned, and an activity that we can continue to do. There's a UHI, Urban Health Institute, that's reaching out into the community. They're interviewing people. And so what a role that I play, and I believe I can speak for Pat as well, is that we call ourselves connectors. And we kind of connect and direct the community with, can I say appropriate resources that support their concerns. We can't handle their concerns, but we can connect them and we can support them and help them in that respect. Thank you.
Hi, my name is Yolanda Sanchez. I come here actually representing the Superfund program at EPA, talking about misconceptions and large bureaucracies. There are 17,000 employees in EPA. We promulgate 6 different environmental statutes. I know very little and have little experience with other parts of the agency besides Superfund. Superfund is our large hazardous waste cleanup program. We were promulgate the Comprehensive Environmental Remediation and Liability Act. And the only reason I bring that up is because Bernice talked about statutory authorities during our panel or our presentation at lunch, and that CERCLA is unique, that Congress had an intent to do outreach and input in that regulation around Superfund sites. So when we promulgated that through our regulations, there are actually written into our regulations that we will do outreach at certain points of the Superfund process. We will get input from the community, and we will supply technical assistance grants to the communities if it's necessary. So it's very unique in that way, and so our program was built on that foundation years ago, doing community involvement. And we've evolved since just doing outreach and input to actually trying to build staff and community capacity to allow for meaningful community involvement around our Superfund sites and decision making. So we've kind of evolved from just, one of the lessons learned I think from our program is that at the beginning we were throwing out money for technical assistance grants, and we were throwing out money for grants for our Superfund redevelopment program. And a lot of times we weren't getting very meaningful results from that money and the grants. And the communities and local governments were really frustrated because they had to actually manage federal grants, which is a very difficult thing to do. And that's a whole different capacity than many of the communities that we're working with. So we shrunk back a little bit and we started developing programs to provide technical assistance through service contracts. Whether it was our technical assistance program, we would work with local governments, we work with local researchers or nonprofit organizations to provide third-party technical assistance to communities. Or we also provide capacity building for local governments to think about redevelopment at Superfund sites, and to get them to partner with local for-profit organizations to think about redevelopment at Superfund sites. So they're kind of in-kind, it's in-kind money that's filtered through contracts to do this type of capacity building work, but it's not done through grants. And I think our programs evolve from time to provide both options for different levels of capacity building. And we've also evolved a little bit from just providing purely scientific and engineering technical assistance to thinking about capacity building. And we try to support our community advisory groups around the country, and many times supporting them best is by helping them understand meeting facilitation and developing mission statements and objectives for how to run their accounts. So we're trying to transition a little bit into how do we do capacity building with those groups so that they can themselves be more able to be meaningful involved in decision making that happens at the site. And then another thing we provide is just that neutral facilitation option. If things are getting a little contentious at a Superfund site, bringing a third party in to help facilitate the conversations between communities and the agency. And then I think one thing I'm learning here, another program that we're trying to push at the headquarters Superfund program is a new program, Partnerships for Technical Assistance program, which is coming to understand our new fiscal outlook for the agency, and that a third of our staff are retiring in the next 15 years. Our in-kind technical assistance ability is going to lessen. So how do we partner with the Hopkins and the North Carolina? How do we partner with these universities and Maryland to provide to help to this connection to provide this technical assistance that we may not be able to do? And I find that we're just getting this program off the ground, but I think we've been targeting researchers who do this work, and I feel like we need to target the connectors. Right. Right, absolutely. So that's just another program. Next year, actually, for our notes, we should probably invite someone from Region 3 to come down, since Maryland and DC is in Region 3 PA, and I'm only bringing the headquarters perspective. It's not really on the ground what you guys probably. So, and I guess the only other thing I wanted to mention, one of my colleagues in the audience, Plan EJ 2014, one of the action items is a community-based projects action. And Pat, you can speak to it if you could wish, but trying to understand, we have a lot of community-based programs within the agency. I just learned about one this morning from my institute. So trying to pull all of those lessons learned from the different communities programs in one place so that we can build and do better with the less resources we might have in the future.
Let's thank our panelists. A lot of information about, and I gave them a lot of questions. But this is, I think, where the rubber meets the road, as with these kind of issues that we're talking about, I think the community should drive and really should be a lot of, engagement in the community. It really is, as all the panelists have said, and being a connector, you're also a contextual expert. So contextual experts, the folks on the ground, the ones that live, the ones that know what's going on, should be really engaged in the process. And as Yolanda mentioned, you have different types of engagement. You have community involvement plans, you have community consultation, you have community-based research, you have CABs, you have CAGs, you have advisory pieces, you have community-based research, you have more community-driven science. Chris and I work with a community partner in North Carolina. We call it community-owned and managed research, where there's no real academic partner. If you need us, you need us. You don't, you don't. We don't do our job, you fire us. So it's really about equity in the funding and parity in the management. Since the community owns the problems, the community should own the solutions. So it's sort of a, so it takes at least in our mind, Chris and I, since we worked together so long, it's really sort of like the gold standard. That's what community should begin to. So I'm actually also on the board of Community Campus Partnerships for Health, which is an international organization that supports and nurtures the use of, CBPR, community university partnerships to address health issues and social justice. Part of what we really want to do in CCPH is really focus more on the community side of that more. And so there's this big movement with CBPR and these other sort of paradigms and approaches to really again, bring up that community piece. And so what we want to do now is to open this up to the audience, give you the opportunity to ask questions, talk about some of what you may be doing, and really have a discussion on how can we take these models, these examples, some of the work that Randall talked about with PRC, with HIV, how can we bring that into environmental justice? Some of the work that Pat and Barbara talked about in Baltimore with demolition, they've done a lot of stuff with East Baltimore as well. How can you take that to Eastern Shore? How can you bring that to Prince George County? How can you bring it to some other counties, to Western Maryland? How can you bring it to DC? Some of the work that Chris has done, what we've done together in North Carolina, how can we replicate that here? And then the funding capacity goes to the government partner, because this is not just about, we're talking about partnerships, different stakeholders, multi-sectoral partnerships coming together. And how can we bring that technical assistance to bear to actually address these issues? And so you have technical assistance from the community side, technical assistance from the academic side to work together to address these issues. So let's kind of just open this up. And remember that energy that Bernice gave you during her presentation. So bring the energy up. Come on, bring the energy up. So let's go with our first question. That's all behind you. Jane, right? Yeah.
I have a question. I hope I can articulate it. It's something I've been struggling with for a while. And this sort of is continuing that struggle in my brain. So I'm just trying to, I hear what you're saying about going into the community and the importance of listening to what they want most and what is important to them. And I appreciate that and I get that, but I struggle with I'm the enviro and I know there's some bad stuff going on that they might not know about. And so I see it happening where companies will go in to be like, what do you want? We're going to give you what you want, which is maybe scholarships for your kids to go to college, or an environmental education center that your kids can go to and learn. Meanwhile, they're polluting the water that they drink and the air that they breathe, and I know they're killing them. But what they wanted was an environmental education center or scholarships, which who can blame them? But I guess I'm struggling with, I don't want to be the person that's going in and telling them what is right for them or what is good for them. But I also, where do you sort of strike that balance where you can kind of educate them about the things you know that they might not know about that are actually hurting them without them even knowing? It's something I'm just kind of...
I can answer. I can give you an example. In our obesity work, for instance, we were one of 10 sites around the country that was trying to do something about billboards and going to purchase places, corner stores, selling high-calorie, low-nutrition food to the African-American community. The network is the African-American Child Obesity Research Network. And so the leaders of this network came to us and asked, will we go into the community and conduct a series of focus groups with parents and youth? And it was a two-part focus group. We went in with our questions, but in the questions we had pictures of Lil Wayne on the bag of potato chips. And so the parents were like, they didn't know that was going on. The youth were saying, oh, that's cool, that's fine. But in the whole process, you're educating them. So the things you talked about, like the poor pollutants offering scholarships, well, Pepsi and Kentucky Fried Chicken and all of those people are offering the same kind of thing. Budweiser beer, all of them. Essence concerts, you know, it's cigarettes, everything coming at you. So in terms of the appropriate resources, we're also trying to say, here are some other things you can ask for. And then, did you ever think of that? So you're getting your information, but they're getting educated. The second week, we left them with one of these kind of little booklets. And they were to look at all the ways that they were being marketed to. The second week, they came back just mad because they didn't even know they were being marketed to, with the lady up on the ad with the Hennessy bottle or the cool cigarette or potato chips and all that stuff. So they were just mad. And it was generational in the first week because the African-American parents were saying, oh, I came up from Mississippi, North Carolina, this is just another way of doing hidden racism, blah, 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 blah. And the kids were like, no, they appreciate our culture. That's why they're mimicking us like that. That's why they have, you know, red, black, and green on and dreadlocks and stuff. They thought that it was valuing their culture. But then when they started looking at this stuff, and it wasn't necessarily the parents of the children, there were different kinds of groups. The second week, they were ready to go. They were like, and we had clicker technology, all kind of stuff, thinking, if you want to hide your answer, you press, you know, the green button. They were like, oh no, I don't care who hears this. So, and then afterwards they were like, well, what can we do about this stuff? You know, I mean, that energy was brought out or whatever. So I think there are ways, and that was just one example, at least with that particular issue, that we were a connector, actually. It wasn't our research or anything, but they needed to reach the community, and we went in and recruited and then found places to do it.
I just want to add something quickly to that. We had the same kind of reaction around the bus depot that was like an alley away from where people lived, and the buses since 1948 had been there, but they were further away from the people. Another community, which was a white community, decided they didn't want their buses in that community anymore, so they sent them down to Kirk Avenue, where lower income African Americans live. And it's like overnight they woke up to all these buses. And then they had, to add insult to it, they had the tail end of the buses pointed to the backyards of those residents. So that, you know, it's like, okay, and it took us, we came to the table in 2003. It took us from 2003 to 2007 to get MTA to even come out and talk to the residents. And it's just been this anger, you know, between them, and I was like, okay, you know, you won't ask me to help, I'm here, you know, how can we work around this? So, and I kept saying to them, okay, we know this is bad, they're not going away, but we've got to stay together and speak in one voice. We have to decide as a community group, what is it that we want? First of all, we want them to get rid of as many buses as they can. So we're working with them, and they're starting to do that. They're getting rid of the old buses and putting in the new buses. It was about 208 buses. Now it's down to like 167. So it's been some progress, but also what the community wanted to do is let's put that green space back that they lost. So you have to keep talking until you can find a way to work this out. Get your political people involved. So because things like you said, you have to have advocacy to go into city council who are making those rules and regulations. You've got to talk to them. They've got to be at the table too. They've got to go to those meetings with you as well. Because if you don't have that political clout behind you, things don't happen. So that, you know, it takes all of that stuff.
Yeah, and as we move forward, let's try to do this. I like your answers. Quick hit.
You were modeling here.
about 30, 45.
I'm sorry.
This is fine, it's fine. Let me go back and then I'll come back. I'm sorry.
So I've done community participatory research on a few occasions, and so I have a two-part question, kind of one for the connectors and one for the academics. So on the academic side, how do we lift this up to be just as important as quantitative research? You know, when we have these rich stories and we have these examples of the community really being involved, that's not funded or looked at as important as numbers and multiple regression and all those horrible things that most people don't want to see when they come to conferences, sorry. And then on the community part, you know, I've worked with youth a lot, and one of the issues in community participatory research is how do we get parents to come out? It was so easy for me to get kids involved in, you know, all different ages, but when it came to the parents and the adults in the community, it was a real struggle. Using all of the suggestions that you've had, making it fun, feeding people, doing all of those things. And it comes from, you know, people getting sick of being researched. And I understand that, but quite often for change, you have to have everyone. And unfortunately, we don't listen to little people like we should. So, you know, how do you get more adults out, and how do we lift this up to be just as important as numbers and statistics?
Who gets the adults? We don't get the children. So it depends, I guess it depends on the community. You know, is the elderly. They're there.
Well, and I didn't have a problem with that elderly. It was, you know, childbearing age people that.
I do family research, and we have to do everything you're talking about. And we have to go to them. Sometimes it's starting at the home. It's not calling the community meeting. Sometimes it's just face-to-face, individual level. What do you need? You know, sort of starting from the inner circle, working out. And then other times it's been the connectors and gatekeepers and block keepers and all of those people, everybody. And still, I mean, then on the other side, in terms of, I got tenure doing this kind of work, you have to, now it's more systematized now actually, there is a group, and maybe Dr. Wilson knows, that actually has all kinds of portfolios and toolkits and everything for scholars who want to package themselves in a way that it's appealing. I do qualitative and quantitative research, but there are just certain, and then you have to do the same thing you're doing with those parents. You have to go to your department chair, your dean, the president of the university, invite them out sometimes. So that was 62.3 seconds.
So it's really both, because to move policy, to change things, you have to have the data to sort of start the conversation, but then you need the heart and soul behind it. So I find with each of the issues that I've been involved with, particularly around industrial animal farming, you have to have the science, but you're missing the picture. If you just look at the multiple regression where you're adjusting out for any confounding and you're carefully selecting your population, your design is appropriate to reduce all those sources of bias, you can tell a good story, but it's so narrow, and it doesn't really do justice to the experience of either the neighbors, of living next to in North Carolina where they land apply animal manures, and you have poop on your front yard, on your car, where you hang your clothes. And in order to go to the local and the state officials, you have to have somebody come out and measure the air and prove that it's feces from an animal. I mean, just the indignity of that is just so striking. So it's combining qualitative interview stories with the quantitative science in a way. It has to be both. And I think that's more examples of that, and people like Steve Wing, who were my mentor and Jacoby's mentor, are really doing this beautifully to try and elevate CBPR from the quantitative side of things and the qualitative side. So it has to be both.
We also use the photographs.
Yeah, I was going to say that, so I was going to jump in real quick. We are using photo voice a lot, actually South Carolina and North Carolina. South Carolina and Maryland. Living in the States. So we're doing a project. You heard about the New Jersey train enrollment that just happened. So I worked with the Granville community. They had a trade over on the chlorine spill, 2005. We're doing photo voice there about how we can look at long-term health issues and also they were impact economically. So how can we get the stories from the community and how can we change that to do the long-term recovery? Because most of them you have a man-made natural disaster. They don't put the money into long-term recovery. It's short-term recovery, and they're, FEMA's gone, EPA's gone. We also are doing work in Charleston, South Carolina, where most of my work is looking at the Port of Charleston, using photo voice, and looking at impacts. And we're also working in Orangeburg, South Carolina, on more rural environmental health issues using photo voice. And in Maryland, we have a food Healthy Heights program. One of my students worked with the Healthy Heights program to do some photo voice on that food justice issues. And we're starting an Anacostia Watershed Fisherman Photo Voice Project and recreational users Anacostia Photo Voice Project. So that's a lot of photo voice. And we're talking about using video voice too. And we're also measuring PCBs, pHs, air pressure monitoring, soil monitoring, cumulative risk assessment at the same time. Okay. I was supposed to go to you next.
Could you just give us a 30-second on photo voice for those of us?
So photo voice is basically taking pictures of focus groups. You have community members go out, they take photos, they come back and talk about them, they pick up the photos that are most important. You have themes, a semantic review, and those themes come out and you can use it as a photo exhibit. Go tell the story to the community and also the policymakers.
Photovoice.org. And I have it in my PowerPoint, so I'll send it to you.
Yeah. So that's and you also can bring photo voice into participatory GIS too. You can have people take photos, GPS it, you put them on Google Maps, they can go in, zoom into their homes, they have that picture, so the qualitative, quantity, you can even code the photos. Score this, based on what you see. So that's also adding quantitative into the qualitative. Okay? So I know the other hands, I'm sorry, I was over a minute. I apologize. Jane, you release your time. Jane, go back. Go ahead, Jane.
Well, I had one question for each of you, but I'll start with the path. You were talking about when you're applying for funding to be sure that there's resources allocated for the people that you're working with in the community. So aside from the example that you gave where you're training some people in the community to continue the research or the
demolition process.
the demolition. Can you talk about maybe some other things that we could be thinking about that would be useful funding that could be immediately applied to the projects that we want to do and give it to that it's allocated for the community?
Well, I think a lot of, like Barb and I, we were part of this environmental justice partnership group. They're like small grants that help community groups to do some of the things that they want to do. Is that okay? So we kind of help them because we do work for Hopkins. Hopkins allow us to do this community outreach. So we're also listening to some of the things that the community wants to do. So we kind of look where we can find that money for them to do that. But the most important thing is that if a researcher decides to do a project, to make sure we connect the community with the researcher. And then when they're writing that grant, that they are part of the line item.
Let's jump to Yolanda.
What's their role? What's the community's role that justifies the grant?
Well, a lot of times your community group, when they want to have focus groups, they want to have they should compensate the residents for their time. Yeah, for their time. A lot, when we have meetings at 6 o'clock, I feel very uncomfortable having people come to a meeting at 6 o'clock and don't even feed them.
There are actually some guidances out there to help you have a conversation with researchers. What is our budget going to be? Who are the roles going to be? Are you going to provide for funding so we can have a part-time someone as a liaison? In fact, we should probably just send these out.
Yeah.
Some of the other things that the community people can do is they can help to design, the outreach, the flyers. They need to be at that table before the researcher sends out that flyer that it is advertising their recruiting, for their research project. So those are some of the roles that they can incorporate in their grant application. The dissemination, reviewing all that material and all that, they should be compensated.
And with CBPR, it's about engagement and involvement in all stages of the research process. all stages. So, and as a contextual expert, your time, you are a contextual expert. You should be valued just like my time is valued. And that's the important part of what we're trying to say. Chris.
And I have to say that, you know, there's a great book that's out there. It's called The Revolution Will Not Be Fun. So if we as researchers think, you know, okay, we're only going to get involved in this sort of issue or that issue based around a grant, I mean, we're stepping into the tail of the wrong foot already. So I really try to think about sort of the privilege dynamic. I mean, being from the university, already there's a dynamic there that's that I need to be aware of. And if there's an issue, I should be coming to the community first as a citizen and then as a researcher, and then seeing how my hat can be worn, you know, either through which hat, right? So that's something I think about in terms of planning. And then if a grant comes out of it, or if there's some kind of planning process, it's equitable and it's grown out of all the discussion. You know, so it takes a lot of time to do this work. It does interfere with sort of the traditional academic research endeavor, which is why it is challenging to do this work. And sort of, as the other question was about, you know, meeting the kind of goals of tenure and also seeking a broader vision of impact and social change. I mean, it's so ironic that many of the scientific journals have impact factors. What is the impact factors? How do they determine that? It's through other scientists and academics citing their papers. That's one way of assessing impact, but there's a broader kind of societal impact that I think